The Tobacco Products Regulation 21 CFR was enacted to establish restrictions on the sale, distribution, and use of cigarettes and smokeless tobacco in order to reduce the number of children and adolescents who use these products, and to reduce life-threatening consequences associated with tobacco use. Tobacco products are used more frequently in areas of low socioeconomic status. This law is an attempt to lower the exposure to tobacco amongst youth and hopefully decrease the percentage of children and adolescents who use tobacco products. Arnold Schwarzenegger signed a bill that requires restaurant chains with at least 20 stores statewide to post the calorie counts of standard dishes on menus. Several other cities and countries have also moved on the issue. The Child Nutrition Act makes major changes in the foods that kids consume while at school or even in foster care and in this after-school programs. A provision of the law requires a healthier nutrition standard besides the regular lunch program and in vending machines located throughout schools. This bill also covers the issue of underprivileged children in schools. Foster children and children whose families receive food stamps are automatically certified for free meals. Poor Americans do not exercise as much due to environmental factors like pollution, conflicting work schedules, and a lack of education. Creating more public parks in close proximity to poorer neighborhoods that have jogging paths away from high pollution levels may encourage more people to participate in physical exercise. Making sure these areas are secure and safe by employing security guards and other public safety officers would help reduce negative tendencies toward violence, which may create an environment that people do not want to be in. Making sure there are physical education classes in schools would help children and young adults get more exercise and educate them on why nutrition and physical fitness are important. By regulating food additives and artificial ingredients in prepared foods and food products, more people would have access to fresher, natural foods. If monetary incentives or tax credits or breaks were offered to farmers markets or farms, more communities with food deserts would have access to fresh produce, limiting the amount of prepackaged, low-nutrient foods consumed. Labeling foods to match the traffic light system, like the UK NICE supports, would classify foods according to color, making potentially bad food choices more obvious. Red labels indicate that food items should be avoided or eaten sparingly. Yellow labels would indicate that food should be eaten rarely with caution, while green labels would indicate that food can readily be consumed and is healthy. There should be stricter regulations when it comes to smoking in public buildings and public places. Smoking is not just hazardous to the user's health, but to those around them. The rights of non-smokers should be respected. To be exposed to secondhand smoke could mean that people who choose better health habits still have the potential to develop heart disease because of someone else's actions. It is also unfortunate when parents smoke in cars or anywhere around their own children for that matter. There needs to be a stricter policy when it comes to smoking around children, as it endangers their health and is reasonable to extend neglect and child abuse laws to include secondhand smoke exposure. Smoking should be completely prohibited anywhere around daycare facilities and anywhere else with a large number of children. The issue with underprivileged children's nutrition is that they get a poor diet at home. This can lead to heart disease in the future. If children get better access to a healthy diet on a regular basis, the number of individuals with heart disease in low socioeconomic communities might decrease. Children nationwide living below the poverty line should be getting lunch for free at school. While food stamps and WIC help poor families get nutrition assistance, there are no regulations on what they can buy. Limiting the types of food that can be purchased with government nutritional programs to healthy options would improve nutrition. First and foremost, the most important stakeholders in healthcare are the patients. In this issue, the patients are the citizens living in this country below poverty. Those living under these conditions are at a greater risk for developing heart disease. One organization which has helped with policy development is the issue in the USDA. With this issue is the USDA. They are on the forefront of ensuring proper nutrition in schools and proper labeling of food in restaurants. This stakeholder is an important choice because we are finding more illnesses being attributed to a poor diet. Heart disease, diabetes, and stroke can be linked to a poor diet. Individuals living in low socioeconomic status communities are more likely to have poor nutrition on a daily basis. Another organization that has helped with policy is the American Heart Association. They spearhead the campaign in eliminating smoking indoors. They also refused to hold any conferences where there was smoking allowed. There is a major percentage of smokers in communities of low socioeconomic status. Smoking itself is a major cause of heart disease. The American Heart Association also actively campaigns, sponsors research, and provides resources for heart health in the United States, making them a valuable stakeholder. Hospitals and medical clinics are involved in patient care. Many of these medical facilities reach out to communities or provide care at low cost because they are nonprofit organizations. This makes medical facilities an important stakeholder. Local farmers markets or farms, or those within 50 miles of a major city, are able to supply fresh produce to communities that suffer from food deserts or have a lack of fresh fruits and vegetables, potentially alleviating many of the nutritional concerns associated with heart disease. Informing, educating, and empowering is an important step in the public health process. Informing and educating the population distributes critical information which allows people to make better informed choices about food, exercise, and other behavior or habits. Empowering the population to take their health into their own hands by giving them the tools to do so will give impoverished portions of the population more power over their lives and health. This is done through giving them choices and viable solutions so they can take responsibility for their own health. Educating and empowering younger generations to make healthier life choices like eating right, exercising, and avoiding negative habits like smoking will change the next generation to improve the future of health within the population. Mobilizing community partnerships within communities creates strong support networks that will provide more people with better access to information, education, and healthcare. This will reduce many barriers to healthcare by creating more partnerships with various organizations to more efficiently serve a wide variety of needs. One organization by itself is not nearly as effective as a group of organizations working together to share and develop resources. Policy development is one of the most important aspects of public health. It regulates the process and allows for smooth program development. Without a plan of action, the implementation of directives and programs would be inefficient. Policies give direction and purpose to research and collect data. They help streamline public health actions in order to maintain and consistently improve a population's welfare. Policies need to be implemented to tackle the causes of heart disease. The reason for heart disease being so prevalent in low socioeconomic status communities is because they are at a higher risk for smoking, making poor diet choices, lack adequate exercise, and have higher negative stress levels. These etiological factors need to be addressed with policy. This is done by developing policies against smoking, and improves exercise and nutrition and other policies. The information in the presentation was gathered from the following resources. We hope that you have enjoyed this presentation about heart disease in populations of low socioeconomic status.